Dr. Mair is Chief Medical Officer of Blood Services for the American Red Cross North Central and Central Atlantic Divisions. Dr. Mair will be followed by Dr. Jennifer Jones of Michigan Medicine. Dr. Jones is the Assistant Professor of Transfusion Medicine at Michigan Medicine, which is the University of Michigan's academic medical center. And then Dr. Jones will be followed by Michelle Maxson of Hurley Medical Center. Michelle is a registered nurse and senior manager of trauma services at Hurley Medical Center. Once their remarks are concluded, then we will open it up to a Q&A with members of the media in attendance. With that, I'll turn it over to Dr. Mair for your remarks, please.
Thank you. Good morning, everyone. Thank you all for being here for this update about the American Red Cross's emergency blood shortage, and to also hear from two of our Michigan hospitals about how the shortage is impacting their hospitals and their patients. I want to thank in advance Dr. Jones and Michelle for joining us for this important update and sharing their insights. The Red Cross is most appreciative to have Michigan Medicine and Hurley Medical Center as hospital partners whose reputation for clinical excellence is well known. But let's talk about this blood shortage for a bit. On January 8th, the Red Cross announced an emergency blood shortage nationwide. And today that blood shortage continues as our national blood supply remains critically low. Currently, blood products are going to hospitals faster than blood donations are coming in. To recover from this shortage, we need to exceed 12,500 donations, what we typically collect every day to meet the needs of patients across the country. To the thousands of donors who have answered our call to donate in the last few weeks, we sincerely thank you. This month alone, thousands of blood and platelet donations have gone uncollected nationally. This is in part due to the severe weather we've seen across the country and in Michigan. The snow, ice, and extreme temperatures have made it tougher to move these vital blood products across the Red Cross network. In Michigan, for example, we've had some 11 blood drives canceled due to severe weather in the last 2 weeks. As a result, 285 units of blood went uncollected. Red Cross is now experiencing its lowest number of people donating blood in 20 years. And when fewer people donate, any disruptions in donations, whether it be severe weather, seasonal illnesses like the flu or COVID, or the recent holidays, have a huge impact on the availability of blood and blood products for those in need of blood. As the single largest blood supplier in this country, being able to collect enough blood donations to meet the needs of patients is vitally important to our Red Cross mission. The people who need this life-saving blood are accident victims, burn victims, heart surgery and organ transplant patients, new moms and premature babies, and those also receiving treatment for leukemia, cancer, or sickle cell disease. To be able to replenish and maintain a sufficient blood supply, we're asking those who are eligible to donate to please step forward and make an appointment in the days and weeks ahead. All blood types are needed, but in particular, we need platelets because of their short shelf life of only 5 days, and type O red cells. Here are 3 ways to make your donation appointment. If you have it, please download the Red Cross Blood Donor app and utilize that. Or you can go to redcrossblood.org to find a blood drive near you, or go to 1-800-RED-CROSS. Please utilize one of those 3 methods. If you're looking for a place to donate, consider one of our 8 blood donation centers in Michigan. We also have mobile drives going on across the state. There's also the big heart blood battle going on at the University of Michigan and Michigan State University through February 21st. They are facing off against Penn State and the University of Wisconsin to see which school can collect the most blood donations and earn bragging rights for the year while helping these patients in need. Also, as a reminder, Wednesday, tomorrow is the last day to make a donation and be entered to win a trip for two to the Super Bowl in February. This trip includes round trip airfare, a 3-night hotel stay, and a $1,000 gift card. If you donate in February, you will receive a $20 Amazon gift card by email. I'm also very pleased to announce that the Red Cross has also started a blood donor rewards program. It's a new way for us to say thank you to those who donate to the Red Cross. Retroactive to January 1st, 2024, all donors will now earn points for each donation that they can redeem for e-gift cards or exclusive Red Cross merchandise. In closing, you have heard the Red Cross say again and again that the need for blood is constant, that every 2 seconds someone in this country needs blood. That said, having a sufficient blood supply is critical to ensuring patients have access to life-saving blood. It is the blood on the shelves made possible by you, by blood donors, that truly helps in times of emergency to save lives. With that, I'll turn things over to Dr. Jennifer Jones at Michigan Medicine to share her experience.
Thank you so much, Dr. Mair. So I actually started working at Michigan Medicine in September of 2023. And since my hire, I've been very impressed with the breadth of care and expertise that's offered here at our hospital. But I have to stress that it's important to realize that sustaining this caliber of care requires a reliable and well-stocked blood inventory. Since my hire, I've also noticed that blood shortages are commonplace. On average, every week or two, our supply of certain blood products like platelets, as Dr. Mair mentioned, reach such a low level that we have to look at every order that comes in to decide if a patient needs a product right now or if they can wait until our inventory gets restocked. As we were sitting here preparing for this briefing, I got an email that we're on shortage again this morning. And for those who have never heard this word platelet before, platelets are a vital part of the blood that prevents bleeding on a day-to-day basis as we're walking around in our lives. Platelets also help us to stop bleeding if we become injured. Patients can develop low platelets under certain circumstances, like if someone has a cancer diagnosis and they're just recovering from chemotherapy, if patients are critically ill in the ICU, and that can include newborn babies who are in our neonatal ICUs, or patients that require large surgeries like aortic repairs or an organ transplant or a neurosurgery. Typically, we can treat these patients by giving a platelet transfusion, but when we're in a shortage situation, we are triaging, as I mentioned previously, and sometimes these transfusions get delayed, or we can do things like take a unit, break it in half, and then give it to patients so that they get some instead of none at all. And those practices are suboptimal, but they are required to defend our inventory and maintain it at a sustainable level. I should also mention that year over year, our need for platelets is actually increasing. And so these needs are just going to continue to happen. And if we kind of don't increase our donor base, these shortages may occur more frequently. Now, I should point out that when these shortages do occur, we can usually get them resolved within a day or two. And that may not seem on the surface like much of an issue, but it's important to remember that the hospital is a dynamic environment. Each patient's course can change in an instant. Where someone didn't require blood yesterday, today they may require 10 units. And more than that, we can't really control what comes through our door and what needs patients are going to have if they come in from a trauma. A case in point, just to give you an anecdote from my own experience, I was on service a couple weeks ago, and we had 2 patients on the floor develop heavy bleeding. And because of this heavy bleeding, they required a number of different blood products, and we then had to go on shortage for that. So a couple hours later, I'm having a conversation with a liver transplant surgeon who has a patient in the operating room, and we're discussing if we're going to have enough blood to sustain that patient through that procedure. And at the back of my mind, I'm thinking, wow, if we have a patient come in for a trauma, or a pregnant person has a hemorrhage after their delivery, a sickle cell patient comes in and needs an exchange transfusion that might require up to 10 units of blood, am I going to be able to sustain that? This unpredictability is the nature of hospital medicine. We have to hold our current blood needs and project forward of what we're going to need in the future in a worst case scenario. On that particular day, I'm happy to report that my 2 patients stopped bleeding. My liver transplant patient got their liver uneventfully, and so I'd consider us lucky that day. If these shortages keep happening, these situations are going to keep popping up. And we're absolutely going to do our best to deliver the highest quality care that we can to everyone. But I can't promise you that someday we wouldn't be so lucky in our endeavors. Now, in order to maintain our quality of care, we do have to have a robust blood inventory. And in order to retain this or maintain this robust blood inventory, we have to have a committed donor base. So I'm here today asking if you can donate if you can. And with that, that's the end of my remarks. So I'll go on ahead and pass it off to Michelle.
Thank you very much, Dr. Jones. I'm happy to be here today to share with you how this blood shortage has impacted Hurley Medical Center as a trauma center, and not only Hurley, but the trauma community as a whole. As the northernmost level 1 trauma center in the state, Hurley cares for some of the most severely injured trauma patients seen in this state. We care for both adult and pediatric trauma patients, not only in our community, but we do have patients that are transferred to us from over 40 different hospitals throughout the northern and eastern portions of the state. Many of these patients are in need of blood very quickly to save their life. As a trauma center, we do depend on having an adequate supply of blood available at a minute's notice when needed for a bleeding patient. We will have the blood ready in the emergency room when the patient arrives, ready to go as soon as the need arises. In certain situations, trauma patients do require large amounts of blood products, which further contributes to the shortages that we have been seeing. We depend on the Red Cross to replenish the blood that we have available for use for our patients. With the shortages they're experiencing, this makes it challenging for us to get the blood replenished. Due to the unpredictable nature of trauma, we have no control over when our patients will arrive and be in need of blood. We can't reschedule them for another time when we have more blood available that we may be able to do if it were an elective situation. Therefore, having a stable blood supply is imperative for the care of our patients. During these critical shortage times, we have implemented strategies to preserve the blood that we do have so it's available when needed. We've been using IV fluid in place of blood whenever possible, and reserving the blood for those patients that are not responding to IV fluids initially following their trauma. All trauma patients must receive a universal blood, the O positive, O negative type, until their blood type can be further determined. So we've implemented strategies to switch to type-specific blood as soon as possible in efforts to save that universal blood for the emergencies coming into the door until we can establish their blood type. With hemorrhage being the leading cause of death in trauma patients, not having adequate blood supply is an alarming situation for our trauma center. Fortunately, we have not been in a position where we have not had blood available for a patient in need. So we are asking that you get out and donate if possible so that we don't end up in that situation and that we do have the blood available when a patient presents. Thank you for your time, and I'll turn it back over to David.
Thank you, Michelle, as well as Dr. Jones and Dr. Mair. So that wraps up our remarks. We now would like to open up the Q&A with members of the media. If anybody has any questions, please come on. We will pull you off mute and ask you to identify yourself by name, your news outlet, and who you want to direct your question to. Any questions, anybody? All right, I'm not seeing any questions. With that, we will close out the briefing. Thank you, Dr. Mair. Thank you, Dr. Jones. And thank you, Michelle, for joining us on this briefing and sharing your important insights. This will now conclude our briefing, and everybody have a nice day. And if you are eligible to donate, please do.